Welcome to the Nursing Dose with your host, Farah. Today I decided to go on live because I've had a lot of nurses asking me really how to gain clarity in their nursing career, what to do next, not quite sure what direction to take, especially a lot of my new nurses who are struggling to find their first nursing job, their first position entering the nursing workforce. So if you're watching, this is for you. Also, if you're a nurse that's working, maybe burnt out, not quite sure what to do next, this is also for you. So listen up. For those who don't know me, my name is Farah, aka Dr. Laurent, the nurse career coach. I've helped over 100 nurses land their dream job, both in Canada and the US. So let me know where you're watching from, what city, what country. Drop any comments or questions that you have in the chat. So let's get started. Again, if you're joining, we're going to be talking about how to get clear on your nursing goals, nursing career, and the 3 tips that I have for you to start making those moves, right? Making those nursing moves, making those money moves, making those business moves. All right, let's get into it. Okay. So, number one is clarity, right? You need to get clarity, and sometimes it's difficult to get clarity alone, so you might need some guidance, right? So what do I mean by that? Get clear on number 1, what type of job do you really want? I know as a nursing student and as a new grad, you hear a lot of different things. I mean, I was told the same thing as a new nurse that I had to start in med surg to, quote unquote, gain my skills. But I didn't want to do that, right? And actually, my nursing instructor laughed at me and said that I would never be an emergency nurse because that's what I truly wanted to do. So, of course, I didn't listen to that. And I still pursued the emergency department because I knew that's what I wanted. I already knew. However, there are a lot of nursing students out there in their senior year or maybe just graduating that feel kind of lost, feel stuck, not quite sure what direction to make. So I say, don't listen to the noise out there and really reflect on what it is that you want. Okay. Here are a couple of questions that you might want to ask yourself. What are your strengths and what are your weaknesses? All right. So, and then what type of traits do you have, right? Personality traits, because that will sometimes direct you to what areas you should be in. So, for me, to give you an example, you know, I love talking to people. I love, meeting new people. I love fast-paced environments. I always need to be doing something, moving around. So I love the fast pace of the emergency department. And I love that it was not boring because it was always something new all the time. And it was complete chaos. And I'm like, great, this is for me. This is exciting. It's not boring. Going to work, you really had to be on top of your game. Critical thinking skills had to be there, great assessment skills, great advocacy, really be able to speak up. And really, emergency nurses and critical care nurses have a little bit more autonomy. So you're not really listening, I guess you could say, to orders, right? Like you work with the physicians, but you're taking more autonomy in triage, for example, doing assessments on your own, assessing the patient, giving them acuity levels, and you're kind of deciding where this patient should go based on how you're trained, on your skills and expertise, right? So I knew I wanted to be an ER nurse. So that's number 1. You need to find out what traits you have, what are your strengths, and what are your weaknesses, and then be able to see kind of what you want to do. In terms of skills, okay, I want to talk about skills for a moment. As a previous director of education, as an educator, both in academia and in the clinical setting, I worked with nursing students, I worked with new grads, and one thing that they're obsessed about, or that you're obsessed about as a new grad or nursing student, is the actual psychomotor skills. right? But you don't need to worry about the psychomotor skills so much, how to put in an IV, how to put in a Foley catheter, how to give an injection. Those things will come with time. Obviously, in nursing school, they'll teach you those things. But if you don't get enough practice, it's okay. Don't think like, oh, because I didn't get enough of these skills, I can't go into critical care, or I can't go into L&D because I didn't have XYZ experience. You will get trained wherever you go. You'll get orientation, you'll get trained. What's more important is to follow your passion and what it is that you truly care about. Because let's say, for example, you really love working with babies, right? Then you should be, perhaps in NICU or in pediatrics or whatever population that you really want to be in. So that's my other tip. Find out what population that you want to work with. Or maybe it's not within the hospital, maybe it's in an outpatient setting, or maybe it's the community as a whole. You want to be a public health nurse or work in the community. So, those are the things I'm talking about. So, number one, take the time to reflect what it is that you really want. What are your strengths? What traits do you have that will make you a good nurse in XYZ area? And then don't worry about the psychomotor skills, that'll come. Just focus on general things like assessment, prioritizing, collaboration, having those analytical skills, because that's truly what you need to focus on. If you're someone that maybe, you know, likes procedural areas, then maybe you might work better in interventional radiology, or maybe in an OR setting or something like that. Okay. So those are all things to think about. But don't worry about what your friends are doing. I know a lot of nursing students are like, oh, all my friends are working. They already got jobs. I'm not sure what I want to do. It's okay. Right. So if you need help and you need some direction, that's why I'm here as a nurse career coach. This is my expertise. I've helped, like I said, over 100 nurses land their dream role. And we work on this area of clarity. I help you understand what type of nursing you should really be going into. Maybe it's psychiatry or something like that, right? There is a place for you. And that's the beauty of nursing. Let's say you do try something out for, let's say, 6 months to a year, and you're like, oh my goodness, like I can't, right? You're not stuck there. You can make the transition and go somewhere else. And you're not wasting time because you've learned some skills that are transferable to wherever you go next. Okay. So, really, I think taking the time to get clear on what it is that you really want in your career is important, because you should not just start anywhere. I meet a lot of nurses who are like, oh, I don't care. I just want any job. No, you don't want just any job. You want to start somewhere where you're passionate, excited about, because you're going to be um, likely to be successful if you're really passionate and excited about where you're going. And that was for me. I love the ER. I learned so much, and I was excited every single day to go there. All right. Let me know if this is helpful. Let me know if you're watching. Put clarity in the comments. If you feel like maybe you're a nurse that needs some clarity, you need help in the job search, you need some direction, put clarity in the comments. Okay. Um, so yeah, that was really the big thing that I wanted to talk about. And then figure out what type of life you want to lead, right? What type of lifestyle do you want to have? That you should figure out first. You should get clear on that, and then worry about the job, worry about the career, because your life needs to be in order first, and you need to figure out what type of lifestyle you want to live. If you don't want to work night shift and you know you hate nights, then maybe you shouldn't be, working in the hospital in an acute care setting, because most likely you might need to start on night shift. It doesn't mean that you will. I'm just saying you might, right? If you know that you have kids, maybe you don't want to work holidays and weekends and things like that, then maybe an outpatient setting might be a little bit more, best suited for you. So think about the lifestyle first, and then think about that next. Okay. And then we're going to get into some other things too, like depending on maybe where you want to live. That's important as well, because a lot of nursing students might go to nursing school out of state and they may not want to go back home to the state they're in, or maybe for, the Canadians watching out there, whatever, a province, like whatever, maybe you move to Toronto or something, you're like, I love Toronto, I want to stay here. Or, you move to California, you're like, I love Cali, I want to stay here. Then you need to figure out your location, right? That's important before you decide on the actual job. All right, so that was tip number 1, was clarity. And then we're going to move into number 2, which is choose wisely and prioritize, especially for my new nurses out there. Okay. That's my tip number 2. Choose wisely and prioritize. So, what do I mean by that? Again, you may be getting offers, let's say, in long-term care or like subacute units and things like that. And you're like, you know what? Oh my gosh, I don't like long-term. I hate everything about it. I don't like geriatrics, but maybe I should just start there to get some basic skills. And you don't really want to go there and you take the job, right? Please don't do that, because you're going to be miserable, right? And it's not always about money. So that's what you need to prioritize. What is it that you really want? Okay, as you're starting out. Maybe if you're, let's say, I understand, maybe if you're financially, you have to get a job right away, you can't wait, and then you just take the first job offer. Okay, I totally get it. You got to do what you got to do to pay the bills or whatever. But I highly suggest that you take your time and choose wisely, because you want to be in a healthy work environment. So you want to not only do your research, but during the interview process, you are also interviewing the employer. And there are many questions that you can ask during the interview, and just the whole vibe of the interview. You need to pay attention to what's going on, right? So let's say your hiring manager is, super nice, facilitates the interview, um, just makes it like a conversation, makes you feel comfortable, not nervous, and things like that. Then you're probably going to think that, you know what, this hiring manager would be pretty cool to work with, right? However, on the flip side, let's say you're interviewing and the interview is so rigid. It's like they're interrogating you. It feels really uncomfortable. The leader, maybe of the interview, who's interviewing is, let's say it's a panel style where there's a lot of different people. Let's say an educator's there, assistant nurse manager. And let's say like the nurse manager is leading it, and you can tell there's a lot of tension. Like, people can't speak when they want to, and there's a lot of like looks going around the room, like you can feel the vibe is tense. Then it's probably not the best environment. Like, I'm just saying, those are just a couple tips, right? That you need to look out for. Or maybe if they're going around the room introducing themselves and everybody there is new, and they're like, oh, I've only been here a month, I've only been here 2 months, 3 months, you might want to start looking into that to say, do they have a high turnover rate? What's going on? And I know a lot of organizations sometimes are restructuring with, leadership, or maybe it's a new facility or something like that. Just take all that into consideration and have that situational awareness as you're being interviewed. The other big sign that you need to look for to avoid toxic work environments is if you ask about what the day-to-day looks like, or maybe if they could describe the orientation and they can't describe the orientation, it's all over the place and it doesn't make sense, or they're telling you as a new nurse that you're going to get like 4 weeks, which is only a month, or like 5 weeks of orientation, then you need to run, because that is not going to be a supportive environment. Obviously, if you're going to be working somewhere like an acute care setting like the hospital, where it's emergency or critical care like ICU, you're going to need at least 3 months to 4 months potentially more depending on how big the hospital, if it's a level 1 trauma, those types of things. You're going to need 3 to 4 months to be able to get a good orientation and find out what that orientation structure looks like. Ask questions. Okay. What's the preceptorship going to look like? How long are you going to be with the preceptor? You know, when are you going to be fully on your own and independent? Ask those types of questions, because it's very important that transition to practice out of school. And then look at the long game, right? Like, where do you see yourself long term? Because you want to be able to reverse engineer. Like, if you know you want to get into a leadership position, or maybe you want to be a certified, registered nurse anesthetist, I can never say that correctly, CRNA, then the steps you need to take. You need to start in ICU so that you don't waste time, right? And by the way, they're one of the highest paid nurses, but of course it's very rigorous, the program. But you can get in, it is possible. So you would know the steps to take. Let's say you want to get into education, or like I said, leadership. Look up a leadership position that you want to aspire to. It'll give you the blueprint of what you should get. Like for me, for example, I wanted to be the director of education. So I looked up all the requirements and qualifications of a nursing director for education. I got my NEABC, which is the Nurse Executive Advanced Board Certification. I got my NPDBC, which is the Nursing Professional Development through the Association of Nursing Professional Development. I got that certification, tons of things. So those are all things that you need to do to be able to climb to the positions that you want to get to. And that's an easy way to have a blueprint, is to just literally look up a job posting. Chief nursing officer, look that up. It'll give you the blueprint and you can work your way up to that, and you reverse engineer that for your career path, because it just lays it out for you. And then residency programs. I've had a couple of shows on residency programs. Definitely check that out on the Nursing Dose. And if you're not subscribed to the Nursing Dose, definitely check that out on Spotify for the audio version, and then also YouTube for the video version of the Nursing Dose with Farah. I interview different guests, and I have tons of tips on interviews, job search for nurses. And if you're interested to work with me, please put money in the chat. And you can reach out to me. We could have a conversation and see, how I can help. So yes, residency programs, they are not made equal. There are some residency programs as little as, say, 3 months to 6 months, or up to a year for the more traditional ones. Find out if it's accredited through the ANCC, because it's a very rigorous program to get accredited. Nurse residencies, but even if it's not accredited, at least if there's a residency program, you're going to get a structured orientation and a structured onboarding. Okay. So that's what I wanted to tell you. And then the other thing that I wanted to tell you about choosing wisely: don't listen to your friends, right? A lot of nursing students or new grads will say, well, you can't get into L&D. Like, you can't get into ICU. You need 2 years of experience, or the recruiter told me this or that. Don't listen to that mess, okay? There are ways that you can make yourself stand out as a candidate. For example, if you want to be an L&D nurse, I highly recommend that you join AWAN. It's the Association for Women's Health and Neonatal Nurses. Definitely check that out. There's discounts for nursing students. So that's one way. You could take things on there like webinars, different educational things like fetal heart monitoring that can build up your resume, right? You could take NRP, neonatal resuscitation, for the neonates. You could take ACLS. Take all these things that can stack up your skills and that you could put on your resume so that you can be more likely to land your dream job as a new nurse. And again, I've helped many, many nurses, over 100 nurses, land their dream role. It is possible. Okay. Put money in the chat if you're interested. All right. And then if you don't, if the hospital you're going to does not have a residency program, that's okay. Just ask questions. Find out how long the orientation is, um, and what type of support that you'll have, and what type of ongoing education you'll receive at that hospital or that facility wherever you go. Okay. So that was number two. And if you're just joining me, we are talking about how to get clear on your nursing career. Three tips that I'm sharing. The first tip was how to gain that clarity to make your next moves. Number two was choosing wisely and prioritizing what it is that you really want. And then number three, the last tip is to be strategic. Okay. I kind of talked a little bit about this earlier, um, but really be strategic about your decisions. Okay. So for me, for example, I worked in emergency medicine in Canada. I stayed in that emergency room for 5 years. I wanted to build a good foundation, a good base. And I knew that I later wanted to be a travel nurse. That was one of my goals. And I wanted to leave Canada to do travel nursing in the United States. So I said, well, I don't want to just leave with only 2 or 3 years experience. I want to have a great foundation. So I worked in a trauma emergency department, got my 5 years in, got some certifications, and I felt really comfortable. Because you have to understand, if you want to be a travel nurse, you are not going to get any orientation. You literally get 1 or 2 days and then they're like, go ahead, you're good, you're on your own. Okay. So that's what I did. I decided to leave Canada and go to New York City. I was like, let me find one of the biggest cities to go to. I went to New York City because I love New York. And I was like, it's going to afford me a lot more opportunities than the city I was in Canada. And of course, I was nervous. I was a little bit fearful, but that's the leap that I wanted to take to make that move to progress in my career, right? And that's what you need to understand. What is important to you right now in this season of your nursing career, right? You need to understand, is it the location? Do you want to be in a particular location, whether it's in Canada or US? I talked to this nurse recently and she really wants to stay in California. So if that's what it is, then that's one of the priorities, right? Number two, are you willing to move somewhere else to maybe get that opportunity that you want? Let's say you want to work in L&D or critical care, and let's say another state, I don't know, North Carolina or something, or Texas or wherever, has a position there that might be great. So you got to make that sacrifice and leave so that you can go start working in that particular specialty area to gain the skills. And then maybe once you're comfortable, then you can leave and go wherever else that you want to go to, right? Or maybe that's not important to you. Maybe what's the most important is getting into a particular hospital, like a teaching hospital, like say Stanford, I don't know, right? They pay really well, they have good benefits, and you want to be associated with that teaching hospital, then that's your priority. Or maybe you want to work down the hospital that's like 5 minutes down the street. Phew, who wouldn't want that, right? Like maybe you have kids, you got to drop them off at daycare, school, whatever it is, and it's just convenient to work at the hospital down the street. Maybe that's your priority, right? So be strategic in your decision making on how to take that next move, next career move. So if this is all resonating with you, if you find this valuable, if you want to learn how to work with me as a nurse career coach and you're interested, put money in the chat. Okay. Or you could just direct message me on LinkedIn. What else did I have down here? Yeah, and really, salary is a big motivator for a lot of nurses, but sometimes it's not. So just find out what it is that you want to do. Maybe it's just quality of life. You want to be somewhere warm, or you want to be close to family. Whatever the case is, be strategic about your next move. Just like I gave the example of the CRNA. If you want to become a CRNA, I can never say it, that you need to know your next move is critical care. You need to be in the ICU so you don't have to waste time. All right. So I hope this was helpful. Again, my name is Farah. I'm the nurse career coach. aka Dr. Laurent. I've helped many nurses all over the US, all over Canada get their dream role in less than 90 days. And y'all, some of them are getting positions like same day offers, same week offers. And I'm talking about new nurses. And don't let recruiters tell you that you have no experience. You do have experience because you went to nursing school. You have your clinical experience, and you have past work experience that you can also bring to the table where you can show all these transferable skills. So again, welcome to the Nursing Dose. Please subscribe for future episodes and all things job search in the nursing world, interview skills, all the great things. Subscribe to the Nursing Dose on Spotify, on YouTube. And if you want to work with me, drop money in the chat. Nurses making money moves, y'all. Get clear on your next career move. I hope this was helpful.